Hey guys, I'm in San Francisco and I'm on my way to meet my friend who just recently remodeled her clinic. So a quick walk through the office is just beautiful. It's the aesthetic is modern, it's clean, it's warm colors. It feels like I would be in a really good place here to get my dental treatment started. But then I'm taking myself and thinking, I get pretty nervous when I'm in the waiting room. So I was just wondering, is there a way that you help patients manage their dental phobia?
So Maria, you're definitely not alone in terms of dental phobia. There's about 15% of the patients who have anxiety when they're at an orthodontic appointment or a dental appointment. I really wanted to help these patients, so I started working with a local San Francisco VR company, and we developed a software for the Oculus Go, and the patient can easily use Oculus in the waiting room, and they use the software to help with their breathing, to meditate, and basically they're more calm before the appointment.
The VR headset takes patients to a calming setting, like a forest or a starry sky, to relieve anxiety and fear. Thanks for letting me try the VR set. It was really great. I feel so relaxed now and like I'm ready to move on to the dental chair.
So in the dental chair, we have the newest iTero scanner. It combines laser scanning with optical scanning, and it basically captures every detail of the tooth up to 30 micrometers of accuracy. It performs 6,000 scans per second, and it quickly generates a 3D image of the tooth. So I'm really happy that our clinic is truly digital now, because patients no longer have to deal with a gooey impression material, and patients don't have to worry about a gag reflex because they can breathe, they can swallow during the scan, and there's no bad aftertaste from the impression material. Also, all the impressions are stored on the cloud, and we don't have to worry about anything being lost over time.
So we're in Silicon Valley, and I have to ask, do you also use AI here?
Of course we use AI, as a lot of my engineering patients would correct me and say machine learning. We're proud to be the first clinic in the Bay Area to partner with a Parisian AI company. The name is Dental Monitoring, and they pioneered this AI technology to track Invisalign treatment after 1.6 million scans. So the technology basically allows the patient to do the scan at home using an Android or an iPhone.
So Sam just came back from a big trip, and he's actually undergoing orthodontic treatment now and using dental monitoring. So Sam, tell us about the experience. Where did you go? How long were you away for? And how did you use dental monitoring?
So we went around the world basically. I went to Africa for a couple weeks, and then Japan, and then finished in China before coming back to San Francisco. And dental monitoring was great. It allowed me to easily use the app anywhere in the world to monitor my treatment. So you take a quick scan and then it sends it to Dr. Chang, and she reviews it, and then she gets back to you within generally a couple hours and says whether you can progress to the next tray or not. And then you just repeat the process, and so I did it a couple times and moved several trays while on my journey.
So you get notifications when you should do the scan with the app, and then that's how you don't forget, right? While you're traveling.
The app has like a notification like you get for like a text message. It says like, tomorrow you should take a scan. The first one is I think 7 days after you switch trays, and then the next one is like 3 days. There's some time period the doctor could set.
During the walkthrough earlier, you mentioned sleep apnea, and I had no idea that orthodontists also diagnose and treat sleep apnea. How's it different from like if you go to see your family physician or another specialist, they use CPAP? Like, what is your treatment like?
So I treat a whole range of patients with sleep apnea from child to adults. And usually children, we do a hyrax expander where we increase the volume of their upper jaw and effectively helps them to breathe better. For adults, we partner up with an Australian company that does 3D printing using titanium. And they produce a very lightweight oral appliance that's customized for the patients. And it's about 10 to 15 grams, so it's very small, and the patient can easily travel with it. And most patients tolerate it a lot better than CPAP.
Dr. Chang, I learned a lot today. Thank you so much for sharing your clinic and your insights with us today.
You're welcome. Come by anytime.
And to our viewers today, thank you for joining us, and I hope to see you next episode. Don't forget to hit that subscribe button below.